Good morning. In one of my previous videos, I talked about colon cancer, and I did say that colon and rectum are parts of the large intestine, but I decided to talk about rectal cancer separately, as the treatment for rectal cancer is very different from the treatment of colon cancer. I am Dr. Rajeev Kapoor, and I am a colorectal surgeon at Fortis Mohali. So, rectum, as I described earlier, is the last portion of the large intestine, and it's about 18 centimeters, and it starts at the end of the colon and then ends in that orifice, that back passage from where the stools are passed. So, cancer of rectum has a very specific method of treatment, and thus we need to be very particular about how that is being treated. What are the symptoms? Rectal cancers usually present with change in bowel habits. In other words, if you're used to a particular pattern of passing stools, that would change. There could be alternating diarrhea with constipation. There could be passage of mucus. There could be passage of blood. And passage of blood is almost fresh blood most of the times. Painful defecation is another cause, presentation of rectal cancer. These can be sometimes very silent, but majority of the patients will have some sort of bleeding, sometimes which is attributed to bleeding due to hemorrhoids. It is not so. So what do? We consult our doctor, and the doctor will do a clinical examination. The tumors in the lower rectum are discovered in digital examination in the OPD itself, and subsequently we go ahead, we do a colonoscopy, take a biopsy to confirm the diagnosis. The CT scan or the PET CT scan is used to know the extent of the disease, whether it's confined to the rectum or it's spread across the body, so that we can stage these cancers and treat accordingly. MRI is very specific investigation for this, and it helps us decide about the local spread of the disease, and then our treatment will depend on the result of that. So in other words, blood test, stool test, colonoscopy, CT scan and MRI all are required to make a final diagnosis and stage the rectal cancers. So how do we treat them? I would say that rectal cancers, majority of the cancers present in stage 2 or 3, but sometimes in 4. And that would mean that the cancer has spread outside its location in the form of small nodules in the surrounding tissues. That is discovered by the PET CT as well as by MRI. So once that stage is discovered, or we make a diagnosis of stage 2 or 3, these patients will be subjected to a combination of chemotherapy and radiation. And then we wait for 6 weeks and then proceed with the surgery, that is removal of this. If it is stage 1, and very few of the cancers present in stage 1, unfortunately. But if we happen to have a patient where it is just confined to the rectum and it is not spread outside anywhere, then surgery would be the first line of treatment. But as I said, majority of our patients would end up getting a combination of chemoradiation first, and then go on to get surgery. Surgery specifically will depend on where the cancer is located, whether it's in the upper rectum or the lower rectum, and the surgical treatment will vary according to that. The upper rectal cancers usually end up being removed and then a joint being made, and divergent stoma or colostomy being made, which is temporary. And thus these patients are operated upon a few weeks later, and then this colostomy is closed so that they can pass to the normal. Why this colostomy is required is that it's a very dirty area, a lot of bacteria. And when we make a joint, if there's a leak and stools are passing through that area, then patients can get very severe infection. So to prevent that, the stools are diverted away so that the joint is allowed to heal. And if there's any leak, that heals without any complications. Surgery for cancers in the lower rectum are treated differently. If we cannot get an area of tumor free area below the cancer, then we will have to remove the entire lower back passage too. And thus the patient will end up getting a permanent stoma. This surgery has to be very precise because if it is not done according to the principles of managing this rectal cancer, the chances that these tumors can come back again more frequently than if surgeries are done properly. These cancers do recur, but then the techniques have to be very precise. So the methods of surgery are usually these days we use the minimal approach. Robotic surgery is a very good option for this because robotic surgery is a very precise surgery, and a rectum is located between the two pelvic bones and thus very limited space. So with robotic surgery we get a 3D magnification and thus are able to dissect much better. If robotic surgery is not available, laparoscopic surgery is still a very good option. The results are equable, and at times, because of various reasons, the surgeon might choose to do open surgery, which still remains the gold standard for this. Later on, the patient would, depending on the final pathology report, will require or might require further chemotherapy. Once the treatment is over, and if we have done a temporary stoma, then we go ahead and close the temporary stoma so that or a colostomy so that the patient can pass through his normally. Patients who end up getting a bag, a permanent bag, are then taken through stoma therapy and are taught how to manage these stomas. And once we take them through the process of irrigation, which can be done in the morning, then these patients do not need to wear a bag. There is a stoma, but then they will not pass tools or soil their clothes, even if they don't wear a bag the entire day. So there are a lot of nuances in this management, and of course, may not be possible for me to describe everything in this video, but I just wanted to give an overall view about so that you could understand as to what are the options for management of rectal cancers. Thank you so much.